How are you guys doing, Resilient Warriors? So I bring into you the fourth issue of the newsletter. I hope you guys are doing well. Remember, I made these newsletters focusing on teachers because of what's going on and because I work at a school. But you know what? These strategies, anybody can use them. So just because it says teacher edition does not mean that you cannot use it. So go ahead, use it, share it, subscribe to the channel, comments if you can think of other strategies that I did not include. I would greatly appreciate it. This channel is for you. It's for you to be able to come and learn maybe something you didn't know, learn a new skill or a new technique. So let's get it started. So Resilient Warrior newsletter issue number 4, feature edition. So first, let's start with mental wellness. What is it? So according to the World Health Organization, mental wellness is defined as a state of well-being in which the individual realizes his or her ability, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. That's what mental wellness is. Being able to provide something, being able to contribute something. Now, this definition in the context of schools applies to both students and teachers, who are at times support systems outside of the household. So a lot of times what happens is students go to school looking for that support from the teachers because that's who they're around a lot of the day. This is why the importance of increasing the ability to support our students, but also take care of ourselves. So it has to be a balance. Teacher can't give 100%, the student give nothing. It has to be a balance. We have to take care of each other, but we also have to take care of ourselves to be able to provide that support. So I'm going to skip now to 10 common warning signs for mental illness. And this is for us to know what to look for. You know, if we have a friend, a student, and we start noticing any of these signs, it's a great opportunity to just ask the question, how are you doing? Are you sad? Are you depressed? Is something going on? If we don't start the question, if we don't start the conversation, everything stays within our own self because there's a lot of stigma, a lot of stereotypes just talking about mental illness. Number one, feeling very sad or withdrawn for more than 2 weeks. Seriously trying to harm or kill oneself or making plans to do so. Severe out of control, risk-taking behavior. Sudden, overwhelming fear for no reason. Not eating, throwing up or using laxatives to lose weight. Significant weight loss or weight gain. Seeing, hearing, or believing things that are not real. Repeatedly using drugs or alcohol. Drastic changes in mood, behavior, personality, or sleeping habits. Extreme difficulty in concentrating or staying still. Intense worries or fears that get in the way of daily activities. So these are some of the common warning signs. If you notice these for your students, your friends, family members, or even yourself, might be a great opportunity for you to reach out to somebody. Ask that question. Because that way, the person who is experiencing that feels supported. Doesn't feel judged by others or by himself or herself. How to help? So a lot of you might be asking yourselves, okay, yes, I see this in friends, family members, students. What do I do? It can be scary, definitely. And a lot of times because we don't want to, we have this belief that we may not want to make it worse. We don't ask questions. We say, well, they'll get over it. Or somebody else must be out there supporting them. Here are 7 things that you can use in helping others. First of all, don't judge students. Be calm and accepting. Listen. That's part of not being judgmental. Listening. Encourage students to get help from the school counselor or trusted adults. A lot of times in schools now, they have mental health commissions. That could be a source of support. But it's also important to see what the student wants. They might not want therapy. They're not at that stage. We cannot force it upon them. That's why school counselors can be beneficial to introduce the student to mental, emotional health, mental wellness, all those different things. Know the warning signs. If we don't know the warning signs, we don't know what we're looking for. It's like driving without direction. We're driving, but we don't know when we're going to get there. We don't even know where we want to go. So it's important to know the warning signs. Create a mental health friendly environment. What does this mean? Validate students' feelings and allow them to talk about it. Again, creating that non-judgmental environment. Classroom management techniques. What does this mean? Start your classroom with some deep breathing. Maybe introduce some meditation, 2-3 minute meditation at the beginning, in the middle of your classroom, or towards the end. Practice positive self-talk. Practice gratitude. That's how you incorporate these management techniques. Accommodation. So if you know that a student is having difficulties, accommodate them. If they need to go for a walk, or they need to take a break from Zoom because now that we're still doing distance learning in a lot of areas, allow them to do that. So they're not going to come and tell you unless you know the warning signs, unless you start the conversation. Encourage good health, balance of school outside activities. So what this means is that not everything's going to be school related. You have to take a break from school. So it's important, maybe an activity with all your students. Identify all the fun things you can do at this moment, your hobbies, your interests. Know where resources are and where available. This means that reach out to the school counselor, mental health clinician, the therapist, social workers if there are there, anybody that could provide you with information about resources. And work with the family. The family has to be involved as well. A lot of times family members aren't aware of what's going on with their children. And if a teacher reaches out to them and lets them know, you know what, this is what I'm seeing. May I provide, may I offer resources? At the end of the day, sometimes parents and the students are going to decide whether they want those services or that support. What you have control over is offering it, opening that door, starting that conversation. So now, because I also like to provide some stress management techniques, that's what we're going to do. All right. So we're going to be practicing how to set healthy intentions for the week. So I want you to start this week, next week, doesn't matter. You can still start it. This exercise serves a dual purpose. It helps clear your mind of worry, stress, and unhappiness, and it creates a clean slate for you to refresh your healthy intent. Again, do not judge yourself. That's very important. So here we go. Take a long, deep breath to calm and get centered. Notice your thoughts and feelings. Let go of anything causing you stress or unhappiness. By imagining it, drifting away with each breath. With a clear mind, set an intention for the week, or for the day, or for the next hour, such as being more compassionate or confident. Express your intention during the week, every day, or every hour. And of course, thank you for being educators, for being teachers, for being there for our children. Next issue, we're going to be talking about self-care. I'm not letting that go. But also, I'm going to start introducing you information about trauma. I appreciate it. I hope to see you again. Please hit the like button, subscribe, leave a comment, constructive criticism, anything. I want to better this. You have a good day, and remember, each one of you guys are resilient warriors. Adios.